we're not at a hospital. We're not in the ER. We don't expect, we're not looking for blood and guts. And
sure.
So it was a big deal. Like, so I heard everybody talk about it. Well, that person's gone. They clean the room. We have to move on. So an admission comes that night and we ask all the history and stuff. Well, then he's lying there and he says, "Did someone die in this bed? Because I feel like someone's holding my feet down."
Welcome to Creepalachia. It's time for some more captivating nursing stories, and who better to do that than Amber from Huntington, the RN from Huntington. That'll be your character name.
Okay, that works.
If that works. So thank you for joining me today.
You're welcome. Thanks for having me.
So I guess let's start out with you and some background on you and where you grew up.
Yeah, so I grew up just down the road in Fairdale. I went to Liberty. I was actually going to be a history teacher, and I went to Concord for a while for that. And it just, I don't know, I started having anxiety, panic attacks. Like, I love history, especially West Virginia history, but I just figured out one day this is not my path. Like, I like to teach, but I like to teach more on like a one-on-one setting.
Mm-hmm.
My aunt is a retired now registered nurse, and I talked to her, and I just kind of started thinking about how I wanted something a little more where I'm running around doing something, and there's a lot of education in nursing. There's a lot of education in healthcare, and I just said, let's try it. Let's go. So I just took the plunge and went to Bluefield State in Beckley.
Heck yeah. Awesome nursing program.
Fantastic. When I chose it, the year before me, it had 100% passage rate on the boards. And there's something to be said for that. And
heck yeah.
Had amazing teachers. I ended up, my first nursing, like my actual nursing job was at St. Mary's in Huntington. I worked there for 8.5 years on the neuro unit. And I still, to this day, even though I may not keep in contact with them as much, I see the people I worked with there as family. Like, that was my first job. We had so many crazy experiences together. We learned so much together. And they were like, at a place like that, you have to work together. Like, you have to. And so...
So the boards, does everyone that trains take the same test from the same board?
Yeah, it's the West Virginia RN board. I think it's a little different now than it was then. When I took it, I think it's this computerized test. You go to Charleston and you get anywhere between like 80 and 260 or 270 questions. And what they tell you is it shuts off when it knows for sure whether you pass or fail. Like, it's sort of just like kind of intelligent thing. It shuts off and knows. Which, funny thing, I was a nervous wreck, of course, and we're up in, I want to say it's like Laidley Tower. It was storming so loud. The thunder was so loud. And I got every single question. Like, I had 260 some questions. So near the end of it, I'm like, my brain is so tired. So once I realized, like, I had every question, I called my aunt and I was like, I didn't pass. I know I didn't pass. And there's a hack, like, you get your official notice whether you pass or not, but they'd say you could go and look up your name beforehand at the RN board website, and it'll tell you what their status is, what your status is. And I'd passed. So I was like,
heck yeah. What was your score, or how they score it?
I don't think you get one. It's been, I'm 40 years old and my memory's shot, but I don't think.
Is it pass or fail?
I think it's pass or fail. Like,
nice.
I didn't see anything. So yeah.
Well, cool. So how long ago was that?
That was 2008.
Okay.
So yeah, I'm not good at the quick math, but I think it's around 16.
So you've had 18 years experience?
Yeah.
Somewhere around that. What was your first job?
Ever was Hardee's on Harper Road. When it was part of like the Shell gas station.
Heck yeah.
And the next one, I don't know if you remember, and my boss there was like the best ever, but the Crossroads Mall had this like kiosk this like tie-dye shirts, Grateful Dead shirts, and then there's like another one with knives and stuff. Band t-shirts, and I worked there for a long time until she closed it.
Oh, that's a fun job.
It was the best.
Hardee's biscuits are arguably almost better than Tudor's.
Yeah, well, it just depends. So I am lucky that in the West End of Huntington we still have Hardee's. I can't. Is there still one in Beckley?
Yes, over there by it's in Leicester
Square. Okay, yeah. And I'm very like I love like the loaded biscuits. The Frisco's are where I go though when I go to Hardee's. I gotta have a Frisco breakfast sandwich.
Biscuit and gravy is definitely better. And but it depends. Sometimes you'll get a biscuit like you can tell when the cook was like, I gotta put some extra butter in this, honey, and then the crust gets all nice.
Yeah.
When it's like that at Hardee's, my favorite thing is just a plain sausage biscuit with a Diet Coke. That's from fair. Hardee's, yeah.
So funny, my brother. So when I worked there, my brother worked the night shift, and one day our biscuit maker wasn't there, so I had to make the biscuits. And I asked him, I was like, "So how'd the biscuits turn out?" And he's like, "Oh, well, they were easy to wrap because they didn't rise." But
so it's flat.
Yeah.
Sometimes you'll get those.
Yeah.
Well, sorry. How cool. So, what was your first medical job?
Actually, so while I was in nursing school, it's a long story why I couldn't be a nurse extern, but I was a PCA at Raleigh General.
What's a PCA?
It's like it's a CNA, like a nurse aide.
Oh, okay.
Yeah. Patient care assistant.
How long did you do that?
I'd say about a year, like just while I was in school.
Okay.
And yeah.
What was the pay difference once you got your RN?
I think I made $9 or $10 an hour there, and I always remember my first like starting pay was $21.19.
Oh, so, sweet! That's a big deal, ain't it?
Once I started getting that money, I'm like, I'm gonna go get a new car. Like,
yeah. Like, I'm gonna spend it all.
Yeah,
give it to me. I'm gonna go in debt for the rest of my life.
I was married, and I my ex had to be like, no. I was like on eBay, and I'm like, I could buy a DeLorean. Do you see? I can afford a DeLorean. And he's like, you can't have a DeLorean. I'm like, you sure?
That's cool. Yeah, my first big boy job was hauling coal.
Okay.
But this was the dark times. Like minimum wage was like $5.15 an hour, and then
in my head it still is.
Yeah. Man, which is crazy. I mean, it's still 8, which has been 8 for like 20 years or something like that.
And inflation's just like.
Oh yeah, it don't matter. You might as well like pay them to be there.
Yeah,
it's Now, no disrespect to anyone out there struggling minimum wage, but y'all know what I'm saying. Like we gotta fix that.
How are you doing it? Like how?
I mean, it's impressive.
Yeah,
to be honest.
Yeah.
But yeah, I started hauling coal, and my training wage was $9 an hour, and then when they train you and let you off, it was like $11 an hour, and I was like, oh, this is big money.
This area,
yeah. I mean, it was nice, but the thing is we worked like 60 hours a week, so we got time and a half for 20 of those hours.
Yeah,
so it was like,
Did you go across like Bolt or Copperston Mountain or whatever?
Oh yeah, I drove. What's that? 81. What's that road going down Bolt Mountain, or is it 99? I can't remember. The one you go over Bolt Mountain and then you go down the hill.
Yeah, I think it's like 99 to 81. Like
maybe that's what it is. I think 99 goes all the way to Boone County.
Yeah.
So we would do this thing. We would come back toward Copperston, and we would do a thing called the 5th gear test. So we would get our vehicle in 5th gear, and we had like these old beater vehicles.
Yeah.
So we get it in 5th gear and see how long we could hold it in 5th gear all the way up that hill.
Oh,
yes,
before it starts
it's so
like
long.
Bottoming out.
Yeah, before you like, you stall out, and it's a good time. You got to do what you can to not go crazy. Yeah, but that was fun. All right, so you getting that big RN money. What was your early years like? Is there anything that stands out to you of like, I made a great decision, or the opposite? Gosh. I don't know about this decision.
All of the above. So my first job, and I didn't know any better, and I think St. Mary's is a fantastic hospital. So this ain't a knock, but I just didn't know it was any different anywhere. And I would have like 10 patients at night, and that's 10 patients on a neurology floor. So we had, and it was like surgical and like pathological neurology. So we had myasthenia gravis, we had fresh strokes, we had spine injuries, fresh spine surgeries. And, your strokes, you were really like Q2 every 2 hour neuro checks, and your spine people, you wanted to walk. So there were nights where I came home and I didn't know the term back then, but I would just ugly cry. Like I would just, I would just like hyperventilate and panic, but at the same time I didn't know any better. And still to this day I absolutely love neuro. Like it's very heartbreaking, but it's very fascinating, like to know the pathologies and how this part of the brain will do this and this part of the brain will do this. But I think I had to leave, even though they changed that. It's just emotionally taxing. But I couldn't have made it without, I had the best coworkers ever. And there were times when I just like, I would have, if we were short, I'd have 13 patients. And I'm like, I think I might have messed up. Mm-hmm. But then like, I don't know.
Now, when you say patients, do you have like a process of like rounds? Do you kind of like, all right, let me walk here, and stay for 5 minutes. Let me walk here and stay, or does it vary on the task?
It kind of, so the go by of like how a shift, it never goes according to plan, but your plan is like you get report, and like what I do now, it's a little bit easier because I only have like 4, but I will go and like just check on everybody, make sure. My joke is like, hey, I just want to make sure no one's on fire before I go. And then the idea is like you look up labs, you look up when their meds are due, when and what meds, and like maybe say this one I'm going to need to watch their blood pressure, and then you start like, you go do assessments. You might pair your assessments with passing their nighttime meds. And in the meantime, you just kind of need to answer call lights or like pay attention to new orders coming in. So after that, like let's usually from 7 to 11, there's no like, let me just round, because you're already like, you already have stuff to do. Like you already have a med here, glucose to cover here. This one wants pain medicine. This one needs turned. But after midnight, sometimes that's when you have your dementia ramping up, or maybe your Sundowners, or maybe even like people in withdrawal, which is a horrible, sad thing to watch. Just keeping people from falling, chasing, making sure everybody's in the bed and not tripping on stuff, or making sure they're clean and happy. But if it is chill, you do want to round every hour and just kind of like, you might just peek in and be like, are they breathing? Do they look safe? Okay, next. Or, you see someone still awake. Are you okay? Do you need anything? And
while tending to the buzzers.
Yeah. And sometimes that feels like whack-a-mole. That's the only way to describe it. But sometimes I like to be busy, but not overwhelmed. And sometimes if it is busy, that makes it go by faster, and you kind of feel like you're not restless, but you're not like, oh, I can't do this,
Sure, yeah. I love that you have your icebreaker line that your go-to. You're like, hey, I'm just make sure no one's on fire.
Yeah, and it cracks a lot of people up. So I'm like,
see, I have an icebreaker too. If someone recognizes me, I'll say, oh, do I need to apologize or say thank you? That's what I do.
Yeah.
And it all, it nails at least 90% of the time. Yeah. But yeah. So explain what Sundowners is, because I've heard multiple nurses say that when it gets dark, things start getting a little weird.
I think like if you have some form of dementia or Alzheimer's or something, the daytime, it's fine. And sometimes it can start during the daytime, but like when the night comes, it's like there's more confusion. Like maybe they'll see reflections in a window and think it's a person. The most bizarre one that I've seen a lot is, how there's the TV on the wall. There's a red light just showing that it's getting power. I can't tell you how many people have thought that was a fire.
Really?
And you're taking like 2x2s trying to put tape on it to cover it up and make it not shine, and it's just making it worse. It like diffuses it. But that little red light, like something's on fire. There's fire over there. Like So
if there's one disease that I wish I could snap my fingers and remove, it would be Alzheimer's.
Yeah, it's so tragic because like you think of how scary it is for them. Even if someone's pleasantly confused, that's one thing. It's still sad. But when you're confused, it's hard not to be scared. And you think about the most basic things you have to do for someone medically become terrifying. Like one of the least favorite things I absolutely feel like the worst human in the world is like, say if there's a woman who's very confused and maybe she needs a urinary catheter because she can't pee, to put a catheter, like I feel horrible about it, but you can't just if they're not peeing, you have to handle that. And
sure,
like it's I'm like, oh, this is horrible.
Well, yeah, and it's one of those things that starts out and it's like kind of a family joke, like, oh, they're old Harry, he just can't remember where nothing is, and then it turns into like, and correct me if I'm wrong, but isn't the way they eventually pass away is they literally forget to breathe? Isn't it gets to that extent? I
think some of it's you forget how to eat.
Yeah.
And then you end up like a lot of it's like they call aspiration pneumonia when, food and stuff goes into your lungs and causes infection. That's a big one. Or you just like, I think your appetite kind of goes away anyway, like because your brain's it's not even there. It's not thinking about like I need to eat to sustain life. I think that's a big one.
It's like just someone's lost in their own mind. And now, granted, you watch The Notebook, and I cry my eyes out. At the end when have you watched The Notebook?
I have.
Okay, so yeah, she has Alzheimer's, and then she has good days and bad days, and then he gets in the bed with her their final night, and she wakes up and remembers him, and then I bust out crying. It's a whole thing.
I'm like,
but that doesn't really happen.
No, not. I mean, I think you might see peaks of, like recognizing someone, but most of the time, you, as long as it's a safe thing to do, you kind of play along with like they're like, I got to get to school, and you're like, oh, remember it's a snow day, like you can sleep in. You have to like you don't argue about it because that just makes them more agitated. It makes them more scared. And you really want to just say what you got to say to keep them safe.
Make them comfortable.
Mm-hmm.
Yeah. That makes sense because, I mean, even, today, if someone tells me something that I know is right, but they tell me it's wrong, I get aggravated.
Yeah.
So it's like they feel that way over... And I try not to be mean about it, but, I'm also a jerk sometimes. But
well, like if someone tells you, no, the sky's not blue or the grass ain't green.
It's like, whatever.
Like, why are you,
Sure. Yeah, that's a good way of putting it. Have you ever, so how long did you work night shift?
I'm actually still on nights.
Oh, okay, cool.
No, it's been intermittent. Like at St. Mary's, I had a couple years where I was a day shift charge nurse. And when I left there, I went to an inpatient rehab, like physical rehab facility. I did nights there. Then I went to Cabell. I did nights there. And I had a major surgery. So I went to kind of recover by working at an office job for a couple years. So that was a day shift thing. And now I'm back at the hospital. And I'm actually going to start days in a couple of months. Because I'm 40 and I'm tired of like the sleep roulette, of like... well, I need to sleep now so that I can be awake here. And
sure.
I'm just not, it's just not working.
It's weird how our bodies respond at 40. They're like, I'm not going to respond.
Yeah. Like no,
normal.
You might think you're no different than when you were 20, but I'm going to show you otherwise.
And I love the 75-year-old listeners like, oh, you just wait, Sonny.
Uh-huh.
Like,
but it's all downhill from here. And I'm like, I know.
Well, but we can fight that. I'm taking about 28 vitamins a day. Hopefully it'll do something. But so is there any particular time that's, have you ever had any eerie experiences at night?
Oh, I have a huge one. I have a couple, but the biggest one that sticks out in my head that I still just think, ew. So it was when I worked at the physical therapy rehab facility. Now, not on my shift. I didn't witness this part, but there was a patient in a room that must have been like sitting on the edge of the bed, and maybe died very suddenly. Like they found this patient in the floor in a very unnatural position. Like there's no attempt to brace their fall. It was very gnarly. There's a lot of blood. It was kind of traumatic for, we're not at a hospital. We're not in the ER. We don't expect, we're not looking for blood and guts. And
sure.
So it was a big deal. Like, so I heard everybody talk about it. Well, that person's gone. They clean the room. We have to move on. So an admission comes that night and we ask all the history and stuff. Well, then he's lying there and he says, did someone die in this bed? Because I feel like someone's holding my feet down. And that was like the same day. We're like, I plead the fifth, like,
sure.
Yeah. And that just kind of, there's a lot of like, call lights going off and there's nobody in the room. Another one was, when I worked on neuro, there was like a big hallway this way and a big hallway this way. And usually neuro, you have all kinds of confused patients, but there wasn't anyone who was confused on our floor at that time. They were bedbound. They weren't able to walk around. And we had 2 different patients during that night call out and say, there's a strange woman in my room. And there's nobody, like respiratory wasn't around. There's nobody could have been. And we looked around, we didn't see anybody.
Sure, so. Yeah. Are you kind of tensed up for about an hour? You're like, oh, this is a little weird.
For some reason it should bother me, but it kind of just like, it's one of those things, like that's the gray area of we can't know. Like we know that we can't know. And if I see it, then, but how many people get killed by ghosts?
Not many.
Yeah. So
at least we don't think. But yeah. But it makes you wonder.
Yeah.
Yeah. So, have you ever been in the room when someone passed?
Oh, countless. Yeah. Sadly, countless times. And the codes I've seen kind of just run like just the normal kind of codes. And I've seen brutal codes where you're sorry to be gross, but every compression, there's vomit coming out. Oh
my.
But I've been in the room when families passed. I've been in the room when patients have passed. And you can see it most of the time. Like you see, like, it's like the tension in the muscles is gone. You know what I mean? There's just everything kind of.
Is that why the mouth like kind of hangs open? And
yeah. And it's, as much as I hate to say as a nurse, not every time and not even most times, but there's a lot of times where you're like, this is the end of a very hard road for you. So I hope this is a good moving on for you, because I know life hasn't been good to you for a few years. You've been stuck in a hospital bed with disease and you haven't eaten food through your mouth in 2 years because you've had a peg tube. And, you think, what kind of life is that? So if you ever hear a nurse say, like, if they're told that a patient died and they say, well, good for them, they're not being evil.
It sucks when someone ages, I don't know, what's the word? Hurtfully? I don't know. Yeah. Just they have a really painful time to get to the end. It's like, and you feel like they want to go. Then you feel like they've wanted to go.
Yeah. And I see a lot actually of, they're either waiting for someone to be there to see someone or waiting for that person to leave so that they don't, But I think a lot of people don't realize that, there's life, there's death, but there's an in-between of like, that's not living. And a lot of people don't think about that when you see like, well, I want everything done for me. And that is still, I will absolutely, like, that's your decision. And I'm not going to like, I want to be a full code or my family member. I want everything done. Then that's what we're doing, baby. But I'll also absolutely understand if you're like, I want to be a DNR at any point in your life. If you're like, I think I'm done with this fight, then I understand.
Yeah, I think it's a wide spectrum of things to check on a checklist of like, okay, is my bladder working correctly? Is my brain working? Is my, I think some people will keep their heart going when they probably shouldn't have.
Yeah.
If that makes sense. Like, I feel like naturally medicine is kept us living a longer time, and it's a very big blessing, no doubt. But at the same time, I think we can force that upon family members later in life when they probably should have just let life naturally.
And I know there's probably this huge like guilt, like I'm giving up on you. But even in like 2007, when I was in nursing school, that's something they had hospice come talk to us, and they said, you know, people live a lot longer, but they live a lot sicker longer, you know, and that's something, you know, they talk about like back in the day when the nurses wore like the all white and the cap and stuff, and they had way more patients than we do, but they didn't survive having like 3 or 4 comorbidities either. Like it wasn't, you know, this person has dialysis, they have diabetes, they have, you know, heart failure and then they have COPD where we're NEDs and this and that. Like we have a lot more to sustain that, which is fantastic in some ways. And in some ways it almost, I see people I have seen, I'm like, hope it's okay, I might get emotional, but I have seen people who are confused but alert enough to know they're miserable, and I've seen them beg to die. Like I have seen too many people beg to die, and people don't want to give up on them, and I get that, but it's hard to watch.
Yeah, and it's usually not who that person was. It's like a completely different person, a person you would never imagine saying that. So when I hear that, you know, like me speaking personally, watching my grandpa age and knowing he was always the most joyful person. Anyone listening that knows him knows how good of a person he is. Yeah. And I love him so much, and I hope I ain't sharing too much for the family, but he's going through a rough time right now. Yeah. And he, you know, it's a struggle. Yeah. And I'm just, it's very sad. Very sad to watch.
That's a good point that you bring up, that when I have a family member that has an expected passing, that's something I really try to speak with the family about, is like, this person is not going to want this day to be what you think of when you think of them. Like, they're going to want you to think of the memories of when they were happier, when they were healthier. And I know this is hard today, but do me a favor. And in a year, like, think of when you think of them and you come to this day when it's been a year since they passed, think of happy memories, you know, make a point to let them be more than the day they died.
Oh, yeah. Yeah. I mean, this guy was my dad. Yeah. You know, it was like, always up and moving. The first person to take me to every practice, the first person to like offer advice. Yeah. You know, he was a preacher, which he still is, but he didn't really force that on you. He would just talk to you.
And I think that's the best way to be. Like, that's not going to push people away. That's going to say, I'm an open book if you want to know.
Oh, yeah. He did.
That's awesome.
He's just a good dude. And that's what I'll always remember. But at the same time, it sucks. Yeah. It just sucks watching someone get old. And I make a morbid joke all the time. I'm like, okay, I'll live hard and we'll get a massive coronary at about 75. And then, you know, I'll have everything taken care of. Yeah. You know what I mean? Now, I don't say that out of disrespect to anyone. It's just saying, like, that's diabetes is dog years. You know, it's gonna be a little sketchy later on. But at the same time, you know, I want to see my daughter's life unfold, and I want to see all these different things. I just don't know what kind of health I'm gonna have. Yeah. You know what I mean? Yeah. So anyway. But so you any other things pop out to mind? Like, have you ever seen anyone that like saw visions right before death, or any kind of
like a lot of times family members, most of the time family members, that they're here, and that is when you're like, we're gonna keep an eye on you. You know, you start like, what's their code status again? Because they saw their mom, and that is pretty common. really, that's the most of it. I hate to say, but I can't think of anything else crazy. Like,
yeah.
I've heard stories, but I've never seen like, oh, there's fire at my feet or, the bad, scary stuff. It's just been.
Well, you don't want to fake it. I mean, you can make up anything you want. I'll believe you. But so the shift, what is your typical shift? Have they always been around the same hours or?
Yeah. Well, like, during the hospital, like when I work at a hospital, it's like 7 to 7. You clock in at like 6:38 and you leave at 7:08. The rehab facility is like 6 to 6. And it's kind of like, I almost kind of prefer that because there's, you don't have constant new orders popping in. You don't have, it's not that I'm not a people person, but it's a little less stimulus with, tons of people in. So I do like that, but it's, most hospitals are 7 to 7. And
have you ever dove into the travel nurse stuff?
I thought about it, when I got divorced. It was kind of my first game plan, except I had recently learned that I have something called a Chiari malformation. And if I was going to travel, I wanted to go to like Arizona, but I didn't want to be that far away from my neurosurgeon. So I stuck around the area. I really, really was tempted. Like that had been something I'd wanted to do, but I figured for my health, I really just want to keep things around here. So.
Is that a neuro issue?
It is, which is really ironic.
I was going to say you're a neuro nurse. So.
You see that too. Like you see, like, I hate to say it, at St. Mary's, I feel like I saw a lot of oncology nurses with cancer and neuro. I did, out of respect for family, I don't want to bring up her name, but there was a nurse. She actually survived. She had a brain aneurysm rupture and she survived it, which is absolutely fantastic to me. But, so this is anyone who knows me is probably tired of the story, but I have to tell how I figured this out because it's hilarious. I feel like I should have known because the symptoms and the fact that I'm a neuro nurse, but I'd went to a doctor, like I'd went to urgent care, I'd went to my doctor. I said, I have this pain in the back of my head and I get kind of dizzy when I change positions, and they would just be like, it's your sinuses. Okay, sure. Take your Flonase. And so I was walking into work one day, and where I parked at that time, you had to walk through another lot that was a gated lot. Well, the gate happened to be up, so I didn't want to like squeeze in through the other part. So I just followed the car. At the best and worst moment, so I heard, "Hey, Amber." So I was looking to see who said it. The gate hit me on the head.
Oh, no.
I thought I'd been like hit with a baseball bat. So by the time I get up to the floor, there's a knot on my head. And my coworker's like, you need to go to the ER. I'm like, okay. So I go to the ER, get a CT scan. And the doctor says, like, you're fine. Your CT scan's good. You just have a contusion on your shoulder. You can go home if you want. I'm like, well, my head does kind of hurt. So I went home, but I was working the next night and I get one of those emails that's like, you have new results in your patient portal. And this is why everybody has a love-hate relationship with those, but I never would have known. Mm-hmm. And I'm expecting that, no acute results or whatever. And it says, cerebellar tonsillar ectopia, suspect Chiari malformation. I'm like, oh, oh, so that's why this and that's why that and that's why this, So I called my doctor, and I said, hey, and can we get this looked at? Because this explains a lot. And we got an MRI, and she was like, usually these aren't very big, so I'll explain what they are. You have your brain, and, you have, it kind of looks like a football almost, except there's this little part in the back that funnels down. That's your cerebellum. It does a lot of fine motor coordination, balance, stuff like that. It gets wedged into your spinal canal, which can, it's like the shape of your skull can kind of push it down and it will herniate into your spinal canal, and it can block that opening called the foramen magnum. It can block it. It gets kind of compressed. So your spinal fluid can't get up there. So you get these like pockets of fluid in your spine sometimes. It doesn't always completely block it, but it will kind of starve your brain of spinal fluid. So she's like, sometimes it's not a very big herniation, and sometimes it is, but most of the time you won't even have any symptoms or this or that. But the MRI comes back and she's like, it's 14 millimeters with CSF obstruction. Which neurosurgeon do you want? And I'm like, so I was very lucky that I worked on neuro and I knew the surgeons and I instantly had a name. Dr. Wordhammer, thank you. I feel amazing.
Shout out.
Yeah, absolute shout out. I had gotten to the point to where I couldn't wash a car without being dizzy or throwing up, and now I can, you know.
Funny thing is, I volunteered on a diabetes ward when I was 8 years old, and then I got diabetes.
Isn't
that's crazy?
It's so weird. Like, totally, you know, it's not contagious stuff, but it just seems to like.
I'm totally lying. Yeah, that was totally a lie.
I was like, if that could be a thing on a bigger city, I've never seen one. I mean,
that's pretty prevalent.
Yeah,
I'm a candy striper in the diabetes ward. It was pretty depressing because no one could get any candy. So. It was terrible.
I mean.
But anyway, you know, it's pretty morbid. All right. So how many days a week? Did I ask you that?
No, but I usually work 3. Most work 3.
Is it like 3 on, 4 off? Or
mine is totally random. Like, we do self-schedule. So I'm like second in line for night shift. So I, you know, after Charlie does his, I do mine. And it's just like, it just happens this particular stretch. I'm like, work 1, off 1, work 1, off 1. So I feel like roller coaster.
Yeah, sure. What is the large amount of patients that you get now? Like, what is the main illness?
Oh, gosh. Sad to say, of a lot of it is complications from drug abuse.
Oh, really?
Yeah, a lot. And I that's something like I really want people to be aware of, that, you know, people think of like the bloodborne diseases you can get. People think of overdosing, but there's so much that people don't think of. Like, I can't tell you how many people I've seen that get, it's called osteomyelitis on their spine. Like, they'll get an abscess on their spine and then they're paralyzed from, you know, somewhere down.
What's that from?
Like infection that travels in the, yeah.
Like needles and then getting infected and it gets in your blood system?
Yeah. Yeah. And I just, it's heartbreaking because you're like, you know, I wonder if you knew this. And I wonder if I, like, a place like this, if I can say it, maybe that'll stop, like, someone be like, wow, I don't want that to happen to me. If I can stop, like, one person, that'd be great.
What are the symptoms? And be very graphic so we keep people.
I think it usually starts with a lot of back pain, but like their legs get weaker. They're like, man, I can't walk, you know, but it gets to where if it's on the wrong or right part of the spine, you might not be able to pee. I've had people where they don't have the strength to have a bowel movement, so they have to be dug out if they're going to have a bowel movement.
Dug out?
Yeah.
Is there a utensil?
No.
Oh.
Like maybe enemas, but...
Oh, okay, so that's how you dig out. Okay, I thought he was literally all right, let's go in there, Floyd.
Oh, there is, brain problems, can't think of the word, but there's disimpaction, where you do, like, glove up, KY jelly, and, like, stimulate it and feel if there's an impaction.
Yeah.
Yeah, and that's not just a paralysis thing. That's just, like, is it, you know, I haven't pooped in 3 days. Do we have, you know, a straight up blockage, or is it just impacted there? Can we fix it just by like boop?
Yeah. Do you tell jokes while you do it, or do you just kind of keep it professional?
Depends on who you're with. Okay. You know, like you read the room about how much, you know, you can joke around with the patient, because you do want their, you know, they're having the worst time of their life anyway. So if you can make them smile, then by all means. But if you know it's gonna bother them or make them feel ashamed or something, you're not gonna.
I'd tell him, I'd be like, you know, John Wayne died of this. Like, oh, that's a really good one to say.
Yeah.
Wow. Well, you really earned your money that day.
All right. How about doing bowel prep on a bedfast person with bed bugs?
What does that mean? Well, I know what bed bugs are. They're like, are they lice in a bed? Is that what it is?
It's a whole specific type of insect. Yeah. But I know that they're very like, once you get them in a house, it is hard to get rid of them.
Mm-hmm.
So you'll see nurses joke, but we're not really joking. Like, we're more afraid of bed bugs than we are MRSA or any of those. Like, there's a whole meme about it. It's got like the shirtless Brad Pitt from Fight Club, and it's like nurses when you say COVID or nurses when you say MRSA. And then like the person in the hazmat suit, nurses when you say bed bugs. 1,000% true. Like,
is it that contagious?
I think it's kind of like, which tuberculosis is the same thing. It's like, maybe not, but once you get it, getting rid of it is like tough, you know?
I'm itching
hard.
Just thinking about it.
Yeah, see, I'm like...
What are you talking about prep? Like,
okay, like if someone's going to have a colonoscopy,
mm-hmm.
and you got to give like either like the jug of Miralax or the Go Lightly, which is never lightly. It's always just diarrhea all night cleaning the colon so that they can get a clear picture for a colonoscopy.
Right.
So...
just fire hose everywhere.
Yeah.
I mean, you contain it, correct? I mean,
yeah.
You put a bedpan under them or...
Usually there's a lot of times if someone's bedfast, I mean, you don't want to assume because you don't want to risk their skin integrity, but a lot of times they're incontinent and they're not going to know. Oh. So we have chucks. A lot of people do diapers. I try to avoid that because there's a lot of skin problems on their own with diapers anyway. It just depends. Every situation's different.
You got to change them quick.
Yeah. You try to.
Did you say chucks?
Okay, think of like pee pads for dogs.
Okay.
But they're actually like, some are the newest ones are really like high tech. Like, they're designed to be really absorbent, and they're most of the time strong enough to where like if someone slumps down in the bed, you can pull them up using a chug. You know, it's not just a dollar store pee pad. Like,
push a button, a newspaper comes out.
I mean, that would be cool. But, yeah.
It's a whole thing.
Like, you want to wick any moisture away from the skin because, I mean, you wouldn't believe how fast you could get a bed sore especially if there's just moisture sitting there. But
how do bed sores occur?
The first like phrase that comes to mind is bony prominence. But you have skin and pressure. Anytime you have like pressure to an area and it doesn't move, you're kind of cutting off circulation. So there's not a lot of healing, and so you don't have as much blood flow there, and then you start getting a wound. And a lot of times they start out with what they call deep tissue injury. It won't look that bad. It just looks kind of purple or dark, but like underneath there, it's bad. So as soon as the skin breaks, you're going to see a cavern. Like it's rough. It's really rough.
Is it mostly elderly that get it, or can it vary?
Not always. We had I did watch your episode with Sarah, and she was talking about the gunshot wounds, like the self-inflicted gunshot wounds. I think of this poor girl. I can't remember her age, but she was very, very small, very petite, and she was a self-inflicted gunshot wound who had survived. And we had to get this special sand bed, and I mean, turn her every hour, if not more, because she had so many like bony areas. So you kind of elevate with a pillow and you have to rotate. But it was there's some people who it's just a fight, you know, and some people, it's not as bad, and some can kind of shift their weight and that helps, but like they have special mattresses with like air that kind of moves and does this thing. Yeah. There's like, if you're in like, there's a whole thing about 4 side rails being a physical restraint, but if someone's in a turn bed, which you still want to turn them, but they're like, you have to have all side rails, or I've seen people fall, like it'll turn them and they'll like kind of roll on out, and you're like, ooh, and that's pretty dangerous. But so you want to have all side rails because it'll turn. Wow. Yeah. It's a huge, like, if we, like, when I get an admission, if there's anybody that I remotely think is like remotely at risk, we slap, it's called a Mepilex, like a bordered foam dressing, and it's got a foam, and you look them up on Amazon, they're pretty expensive, but you put them on the heels, because the back of the heel is a big problem area, like the sacrum, coccyx area. You slap a foam on there, and that helps. I mean, it's not a problem solver, but it helps a lot.
Interesting. Yeah. Now, the self-inflicted wound, did you all get her because it went through her brain? Is that kind of how it worked?
Yeah.
How long was she in a coma?
She was like, when I had her, she was doing what, like, gross motor movement. Like, she could kind of hold a crayon, like if you're teaching a toddler, and she'd gotten to where she could write simple words. Mm-hmm. She couldn't speak. You know, she was alert. But a lot of times, yeah. But a lot of times I've seen completely awake, alert, oriented. Maybe it missed the brain and went like through the jaw or something. But
You've seen multiple?
Yeah. Oh, yeah. Yeah. I've seen disintegrated jaws. I've seen maybe just some small deficits still, but functional, you know, and that's why I'm like that. She's not that we want to give the right way to do it, but that's not the way to do it. I'll tell you that. Like, definitely not the way to do it.
Sure. That's so sad. And she didn't end up talking before she left?
Before she left, I don't think. That is one of my first, like, wow thing. Well, I was a baby nurse, you know? So it was one of the first things I remember. So so it's been a long time and my memory's not great. I know she went to a rehab known for being really good with that kind of thing, like really good with like neurological injuries. Mm-hmm. So I would hope she did as good as you could with something like that.
Yeah, I hope she's okay now.
Yeah.
You know, but at the same time, I mean, odds are you're going to have a tortured life after that.
Yeah.
Very sad. Do they do brain surgery in Huntington?
Oh, yeah. I mean, that's where I had mine.
Right.
I've seen multiple, like, a lot for, told you I can't, my memory's awful, but glioblastomas. Mm-hmm. I've seen it like Is
that cancer?
Yeah, that is the most common form of brain cancer and also the most deadly. And it is very fast. It's very sad because I've seen people walk in talking and they just happen to have a seizure one day and a week later they're going to hospice. It's very bad.
I try every day. I wake up and I'm like, thank God. Like, it really, I got another day, you know, and it's weird to feel like that, I guess. I don't know, but I just want to, like, there's so many people that just have one day go by and it's completely changed. And forever.
I think that's one reason that neuro was, I hate to leave it because I feel like it's such a needed thing, but I saw a lot of, you know, grandma was driving to church. She cooked for the potluck dinner. She played piano. And the next day she's had a massive stroke and she's never going to leave a hospital bed again. And that you see over and over again, and it's really hard. And you know, I think that's one reason I went to rehab, because I was like, I want to actually see the positive side of this, and I want to see people get better, because I'm really sad right now. I'm really sad. Like,
sure. Well, yeah, you kind of, and I understand when nurses get this hardened, callous nature, because
you kind of, like, I remember my ex, and I'm not knocking him at all.
Let's do it. Throw him under the bus. Let's bring out text messages.
Oh, Lord.
I'm kidding. No, go ahead.
But he judged me because there was a lady, she was kind of younger, and she had what they call encephalopathy, which is like where the brain, you're confused from chemicals, really. And the way that layman's, like, they pickled themselves on alcohol. And she was very confused, and she was kind of looking at the buttons on the side of her bed thinking it was a coffee machine and trying to make coffee. And it's sad. It's very sad, but we kind of laugh, like it's that dark humor.
Sure, yeah.
And he called me out for being, and I kind of appreciate him doing it, because it's kind of that, like, slap on the, like, hey, remember she's a human, you know. But he was like, that's kind of sad. Like, I can't believe you're laughing at that. And we were like, well, it's not that I don't recognize that that's tragic, but you kind of have to. Like, if you see this day in, day out, it's kind of hard to move forward without kind of having a little bit of dark humor.
Oh, yeah. Well, comedy was born from pain. That's how it started.
Yeah.
So,
yeah,
I understand that for sure. And, you know, you want to kind of be aware of where the family is, I'm sure.
Yeah.
You know, go back at the card table and be like, whoa, that was, you know, crazy. But, so now your current patients, is it still around 10, or does it just vary?
So I'm on a 9-bed unit, which is part of, I kind of partly did that because of health issues and stuff, but I know it's kind of trendy almost to be like bitter about where you work, but I actually really like where I work. Mm-hmm. And there's me and there's another nurse, and then there's a PCA, like a nurse aide. So I'm always in charge I wouldn't say always, but most of the time I'm in charge. So I have 4 patients and the other nurse has 5. So if I'm working with an LPN, I can kind of go do the things that like pushing the cardiac meds if I need to and stuff. But so I think 4 is a pretty good number, which being a nurse, I've had horrible nights with 3 patients. I've had great nights with 10. Mm-hmm. It's just all in the acuity and all in luck, but I think 4 is good. It's easier to know what you need to know on the fly about 4 people than it is 10. Mm-hmm. So I'm grateful for that number, if that makes sense. Like,
oh yeah, definitely. How do you keep your positivity going? Because seem like a very positive person. Thanks. So I'm just curious how you're not like walking around like, oh, life sucks.
I mean, we all have days like that. Sure. I think most people in the hospital are having the worst day of their life, and you want to do what you don't want to drag it down even more. And I have seen worse. I've worked I don't want to drag the places. I just know that wasn't the place for me. And when it wasn't the place for me, it like when you're not working at the right place, it makes your life kind of hard. And appreciating my own health after, like, I've had my brain cut on and I'm still walking. I'm still, working. I ride a motorcycle now. Like, I can do almost anything I want to do. So I can't be bitter about that. Like, I'm gonna be grateful. And listen, Ariel, I love you. My best friend, I remember her calling me out in middle school for being mopey and whining about things. And I still think about that day. I was kind of salty about it that day. She's like, why you're too negative all the time. And, the more I see, if you see things if you make the effort to be grateful for things and be in a positive mindset, I think it really does attract more positive energy.
Really does. I mean, like, the guy who wrote The Secret is crazy, I think, but there's something to the whole thing of affirmations.
Yeah. I mean, I'm not like super like, a lot of the cults will give you stuff like that, Sure. But I really do think at the very least you'll notice like people are more prone to write negative reviews about restaurants. Like they'll go to write a negative. You're like, if they have a very positive time, they kind of move on with life instead of going and writing that positive review. And I think it's a very hard world to live in sometimes right now. Of course, there's been harder times, but I think pushing out a little bit of positivity, if it helps someone, then that's great.
Yeah. Well, I mean, definitely the perception of the world is that everyone is, hateful and depressed. But I think that perception is twisted from what we consume.
Yeah.
And then we automatically think what we're consuming is real life. But in reality, if you was to, let's say, just take in your own neighborhood, most likely it's just going to be very peaceful and loving.
Well, like I live in Huntington, and a lot of people are like, man, I hate it here. And the roads could be better. I have cracked a couple wheels on those roads, but I love living in Huntington. Like we have these, like, we have like festivals, we have a lot of cool places to eat, and tell me what we can't do here that we can do somewhere else.
You got the place with the root beer mug and the hot dogs.
Oh, Frost Top.
Yeah.
I buy the root beer from there by the gallon. So we've got Frost Top alone is worth it. But Austin's ice cream. If you go to Huntington again, get you some Austin's ice cream. They have it year round in the market, but in like the Canova area, during the summer, you got to go to the OG Austin's ice cream.
Yeah, like there's a Stewart's there too, ain't there? Ain't there Stewart's root beer somewhere? But I think Frost Top's better.
Sorry, Stewart's, but Frost Top wins.
Yeah. Well, it's local, right?
Yeah.
So you gotta go local.
Yeah.
Got the big root beer mug spinning around on the thing.
I remember when it was missing for a while because I think it was getting maintained. I'm like, this just ain't right.
Yeah, it's not the same.
Yeah.
That's great. Well, I think what you do is just so valuable to the community, and we often don't appreciate it enough. So
well, I appreciate that.
yeah, it's very it's very useful, and so there are good stories, recovery stories, right? That happen. I mean,
I actually have one.
Okay, tell me
if it's cool.
Yeah,
and it's funny because my dad ended up knowing, like, she knew my dad, so she had crushed up, I think, like a Lortab and shot it up. And they have like a thin paper lining. A lot of pills have like a thin paper lining, and it went up to her brain and caused a stroke. I know the first time I had her, and again, it's been a long time, I can't remember which side, but she was paralyzed on one side of her body. She has been, still to this day, is one of my favorite patients. We would talk forever. I don't know why I always remember her room was really close to the med room, and we have the Pyxis machine where you pull meds from. You, like, if you're wasting a narcotic or a controlled med, or if you're putting one back, you need another nurse to witness that you're doing what you're doing.
Mm-hmm.
And we'd always like open the door and be like, can I get a witness? Can I get a witness? And she always thought that it was like some kind of inside joke, like, can I get a witness?
Mm-hmm.
But she had showed me like a picture of her kid and said, this is why I need to get better. And I noticed she had the same name as my maiden name. And I'm like, do you know any Blankenships from, like, Wyoming County? And I don't think we're not related, but she knew my dad, and my dad knows her mom. So, dad's kept me updated. And as far as I know, she's doing amazing. She said she wanted to get a job helping people. And I think that is one of the biggest reasons why, whether or not someone has an addiction, I don't even like to say addicts, because there's more to the person than just what their problems are.
Sure.
And I think it's so important to treat people like humans, and you never know when that's going to help them out. Like, just being seen as something other than what they've messed up with, Oh
yeah, that's a huge goal of the show, is to, destigmatize what addiction is and realize that these are people, each with their own individual experiences.
Yeah, like humanize. And I've always appreciated that, by the way.
Yeah. Well, and are there jerks? Of course, but there's jerks across the board.
That's what, there's good and bad people who use drugs. There's good and bad people who don't. Like, so I'm not going to judge you until you show me bad character that warrants it. You know?
Yeah. If you're suffering from addiction and you rob someone, that's a problem.
Yeah.
But there's a majority of people don't do that.
Yeah. Or like if you endanger someone by leaving your needles around kids or something, then that's, hey, don't do that.
Yeah. You can't. I think you can be empathetically accountable.
Yeah.
For sure. So, well, I appreciate that story. What do we plug? I mean, we don't want to plug your unit, but I guess, like, hey, if you need a brain surgery, come on down to,
Well, I will, Dr. Werthammer at St. Mary's Neuro Surgery. Yes. I work at Cabell now across town. And like I said, I really do think it's a good hospital. I think we've got a great cancer center. I worked on oncology for a few months, and the staff there is amazing. They're very hard workers. It's, if you're in the Huntington area,
if you got a headache, stop on by.
Let's hope you don't have a problem, but if I think you'll be in good hands.
Yeah, for sure. Well, what do you do, like, for a hobby? Do you have any kind of fun things you do?
I'm a jack. Well, I'm not even a jack of all trades, but I do all kind. Like, I make earrings out of polymer clay. I'm trying to do, like.
Do you have a business?
I do.
Shout it out.
I do. Okay. It's on Facebook. It's just called Handmade by Amber, if you search it up. I'm working on making different things like keychains and bookmarks and stuff, but that's not here yet. The other thing I do is I ride motorcycles.
Oh, nice.
Yeah. And I didn't get to this year. I love like race car stuff. Like year before last, I autocrossed my car a couple times. I've had a Camaro on the racetrack at the Corvette Museum. That was fun.
Wow.
But
I would have never guessed. That's awesome.
That's I always like to be surprising, but yeah, that's too expensive of a hobby to keep up though. But
well,
yeah.
cool. Well, I'll definitely put your earring business on the description. Yeah. Get some earrings from Amber.
Yeah, buddy.
Yeah.
Cool.
Well, thank you for being here. I appreciate the stories. We'll have to do this again.
Okay.
Yep. Yeah. Everyone else out there, before you leave, be sure to like this video, subscribe to Creepalachia on YouTube if you haven't. If you're listening on Apple or Spotify, take a minute and leave a review. That'll really help the show be found. And we are on Facebook, TikTok, Instagram. We have merch now, creepalachia.shop. We have a cryptid series of shirts that are still in pre-order, about to sell out, and we are shipping soon. So thanks again, Amber. Everyone else, always remember, above all else, long live Appalachia.
Yes.